Graves' eye disease, also known as thyroid eye disease, TED, or Graves' orbitopathy, is an autoimmune condition that primarily affects the eyes and is often associated with Graves' disease, a disorder that leads to the overproduction of thyroid hormones, hyperthyroidism. Causes and risk factors. Graves' eye disease occurs when the immune system mistakenly attacks the tissues around the eyes, leading to inflammation and other symptoms. The exact cause is not well understood, but it is believed to be related to genetic and environmental factors, as well as an immune system dysfunction. Risk factors include Graves' disease. The majority of people with Graves' eye disease also have Graves' disease. Smoking. Smokers are significantly more likely to develop TED and experience more severe symptoms. Gender and age. It is more common in women and typically presents between the ages of 30 and 50. Radioiodine therapy. Used to treat hyperthyroidism, this can sometimes exacerbate eye symptoms. Symptoms. The symptoms of Graves' eye disease can vary in severity and may include bulging eyes, proptosis, a noticeable protrusion of one or both eyes, eye pain and pressure, discomfort, particularly when moving the eyes, redness and swelling, inflammation of the eyelids and conjunctiva, double vision, diplopia, due to misalignment of the eyes, vision loss, in severe cases, due to optic nerve compression, dry, gritty eyes, caused by reduced tear production or increased evaporation. Diagnosis. Diagnosis of Graves' eye disease typically involves medical history and physical examination, reviewing symptoms and examining the eyes, blood tests, to check for thyroid hormone levels and thyroid-stimulating hormone, TSH, receptor antibodies, imaging tests, MRI or CT scans to assess the extent of tissue inflammation and eye protrusion. Treatment. Treatment aims to manage symptoms and may include medications, corticosteroids to reduce inflammation, and other immunosuppressive drugs, artificial tears and lubricating ointments, to relieve dryness and discomfort, radiation therapy, to reduce inflammation in severe cases, surgery, for severe proptosis, double vision, or optic nerve compression. Surgical options include orbital decompression, strabismus surgery, or eyelid surgery. Managing Graves' eye disease. Quit smoking, essential to reduce the severity and progression of the disease. Control thyroid levels, keeping thyroid hormone levels stable through medication or other treatments. Protect the eyes, wearing sunglasses to shield from wind and UV light, and using eye patches if necessary. Outlook. The course of Graves' eye disease can vary. In many cases, the disease stabilizes or improves after 1 to 2 years, though some patients may experience chronic symptoms or require ongoing treatment. Research and support. Ongoing research is exploring better treatment options and the underlying mechanisms of Graves' eye disease. Support groups and patient organizations can provide valuable resources and community for those affected by the condition. For more detailed information and personal guidance, consulting with a healthcare professional specializing in endocrine or eye disorders is recommended. Treatment for Graves' eye disease, thyroid eye disease. Graves' eye disease, also known as thyroid eye disease, TED, is a complex autoimmune condition that requires a tailored treatment approach based on the severity and progression of the disease. Effective management aims to alleviate symptoms, protect vision, and improve the patient's quality of life. Below is an in-depth look at the various treatment options available for Graves' eye disease. Initial assessment and monitoring. The first step in managing Graves' eye disease is a comprehensive assessment by an ophthalmologist, often in collaboration with an endocrinologist. This assessment includes detailed medical history, understanding the patient's thyroid status, smoking history, and symptom progression. Physical examination, examining the eyes for signs of inflammation, proptosis, eye bulging, and muscle involvement. Imaging studies, MRI or CT scans to evaluate the extent of tissue changes and inflammation around the eyes. Medical treatments. Medical interventions are aimed at reducing inflammation, managing symptoms, and stabilizing thyroid function. 1. Corticosteroids. Purpose: to reduce inflammation and swelling around the eyes. Administration can be given orally, intravenously, or through injections directly into the tissues around the eyes. Considerations: long-term use can have significant side effects, so it is typically used for short-term management. 2. Immunosuppressive therapy. Medications, drugs like mycophenolate mofetil or azathioprine can be used to modulate the immune response. Purpose: to decrease the autoimmune activity that contributes to TED. 3. Teprotumumab. Mechanism: a targeted therapy that blocks the insulin-like growth factor 1 receptor, IGF-1R, which is involved in the autoimmune process of TED. Efficacy: has shown significant promise in reducing proptosis and improving quality of life for patients with TED. 4. Radiation therapy. Application: low-dose radiation can be directed to the tissues around the eyes to reduce inflammation. Considerations: often used in conjunction with other treatments and typically reserved for more severe cases. Symptomatic relief: several measures can help manage the symptoms and improve comfort for patients. 1. Lubricating eye drops and ointments. Purpose: to alleviate dryness, irritation, and the gritty feeling often experienced by TED patients. Usage: artificial tears during the day and lubricating ointments at night. 2. Prisms in glasses. Purpose: to correct double vision, diplopia, by aligning images seen by each eye. Application: prisms can be incorporated into eyeglasses to help improve visual function. 3. Sunglasses and eye protection. Purpose: to protect sensitive eyes from wind, dust, and UV light. Recommendation: patients are advised to wear sunglasses outdoors to reduce discomfort and further irritation. Surgical treatments. In cases where medical management is insufficient or when significant structural changes have occurred, surgical intervention may be necessary. 1. Orbital decompression surgery. Indication: for severe proptosis or optic nerve compression that threatens vision. Procedure: removal of bone and/or fat from the orbit to create more space for the eye and reduce pressure. 2. Strabismus surgery. Purpose: to correct misalignment of the eyes and alleviate double vision. Procedure: adjusting the position or tension of the eye muscles. 3. Eyelid surgery. Indication: for retracted or drooping eyelids that cause exposure or vision problems. Procedure: surgical adjustment of the eyelids to improve eye coverage and function. Lifestyle modifications. In addition to medical and surgical treatments, certain lifestyle changes can help manage TED. 1. Smoking cessation. Importance: smoking significantly worsens the course of TED. Quitting smoking is one of the most impactful steps a patient can take. 2. Regular eye checkups. Purpose: to monitor disease progression and adjust treatment as needed. 3. Healthy diet and stress management. Benefits: a balanced diet and effective stress management can support overall health and potentially reduce the impact of autoimmune diseases. Conclusion: Graves' eye disease requires a multifaceted treatment approach tailored to each patient's specific needs. Early diagnosis and comprehensive management can significantly improve outcomes, protect vision, and enhance the quality of life for those affected. Collaboration between patients, ophthalmologists, and endocrinologists is crucial for successful treatment. For the latest and most personalized advice, patients should consult with their healthcare providers, as advancements in treatment options continue to evolve. Graves' disease is an autoimmune disorder that often affects the eyes, leading to a condition known as Graves' eye disease or thyroid eye disease, TED. The symptoms can range from mild to severe and can significantly impact quality of life.